Hey guys, welcome to another video with me, Louie, Christine, and Kyla. So today we're gonna talk about the diagnosis, case finding, and lab findings of an 81-year-old female with aggravated surgical wounds, a case of Carbapenem-Resistant Enterobacteriaceae infection.
Case history. An 81-year-old female patient was admitted to the hospital due to an aggravated surgical wound. It is an incision made during a past surgery that is not healing well or seems to be getting worse. She underwent embolization, which is a minimally invasive treatment that blocks one or more blood vessels. In this case, it is done to block a ruptured cerebral aneurysm and had been receiving rehabilitation treatment in a specialized facility. She had a history of hypertension and diabetes mellitus with no significant travel history. As she was admitted in the ward, a stool culture was performed.
So as for the laboratory findings, we have the stool sample. The stool examination was positive for Klebsiella pneumoniae. So the bacterial strain was ESBL positive. When we say ESBL positive, it means extended spectrum beta-lactamase. The beta-lactamase are enzymes produced by some bacteria that may make them resistant to some antibiotics, and these bacteria are usually found in the bowel. It was resistant to the following drugs, such as amoxicillin, trimethoprim, aztreonam, amikacin, and etc. These are the drugs it was resistant to.
So, Klebsiella pneumoniae, it is a gram-negative rod, facultative anaerobic. So, facultative means pwede siya may oxygen, pwede din wala. Normally found in human intestines, gut opportunistic strains, also found in human stool, capsulated, non-motile bacteria. It is urea positive. Production of gas is also present, lactose positive, catalase positive, and oxidase negative.
So here we have pictures of Klebsiella pneumoniae on Colombia blood sheep agar, which is a mucoid colonies after 24 hours of cultivation in aerobic atmosphere on the left. And on the right, we have Klebsiella pneumoniae on McConkey agar, which has mucoid convex and lactose positive colonies. And it's also cultivated in 37 degrees and 24 hours.
Diagnosis. For this patient, it is cerebral mycotic aneurysm, or also known as infective or microbial aneurysm. It arises from bacterial infection of the arterial wall. Klebsiella pneumoniae is rarely reported as a causative pathogen because Staphylococcus aureus and Salmonella species are the most common causative pathogens.
So here are the review of terms that were discussed previously. We have the carbapenem. It means the class of highly effective antibiotic agents commonly used for the treatment of severe or high-risk bacterial infections. We also have ESBL, as explained earlier, the extended spectrum beta-lactamase. The beta-lactamase are enzymes produced by some bacteria that may make them resistant to some antibiotics, and these bacteria are usually found in the bowel.
So, the case summary. So, first is we have the chief complaint. So, yung chief complaint ng patient, which is the aggravated surgical wound. Tapos, nalaman sa lab na pag stool examination, the patient is positive for Klebsiella pneumoniae and the bacterial strain was ESBL positive. And then, finally, the diagnosis is cerebral mycotic aneurysm.
Thank
Thank
you.
you, guys.
Thank you!
Thank you for listening.
Bye-bye.
Bye-bye. For another video, click on Louis' link down below and subscribe to her channel.